Good afternoon and good evening to all. My name is Lena Leone, and I'm the Healthcare Marketing Manager at Zebra Technologies. And I'd like to thank you for joining and welcome you to today's webinar titled Increasing Patient Safety and Decreasing Costs with RFID Asset Tracking. So prior to starting, I would just like to remind all attendees to ask questions via the Q&A tab at the bottom of your screen. You take your mouse and work your way down the screen, the Q&A tab will pop up. The chat functionality is not enabled for this webinar. So if you do have questions, please use that Q&A tab and we will address questions at the conclusion of the presentation. Today's webinar is a joint presentation created with the partnership between Zebra Technologies and Tagnos Solutions, and of course highlights the implementation of the RFID solutions at Hull University Teaching Hospital. So I'm joined today by a panel of experts, and I'm very excited to introduce our three presenters. Chris Sullivan is currently the Global Healthcare Strategy and Practice Lead at Zebra Technologies, where he uses his expertise as an industry educator and solution provider to address industry needs. His diverse background allows Chris a unique point of view when speaking on the trends shaping the industry, and as such, makes him a visionary leader in the healthcare space. When he's not busy advocating for his role technology plays in improving quality, safety, and efficiency of patient care, Chris can often be found speaking at industry events and sharing his expertise on multiple boards and healthcare organizations, which include the Swedish Covenant Hospital Board of Directors, the Healthcare IoT Community Board, the HIMSS Greater Illinois Board, and the GS1 Healthcare US Committee. Eric Davidson is the Chief Customer Officer at Tagnos, overseeing customer engagements across a broad spectrum of healthcare workflow use cases. Eric has particularly extensive expertise and experience with real-time location system technology, and he personally holds 2 issued patents as an engineer who developed location tracking technologies, and he also has real-world experience as a strategic business leader deploying technology in ways that create true value for customers. Sarah Atkins has been a registered nurse for 20 years with a career in surgery as a scrub and anesthetic clinician. Her accomplishments include implementation of robotic surgery to Hull University Teaching Hospital, and she joined the Scan for Safety team in January 2022. Sarah is currently the RFID and Scan for Safety Specialist Nurse at Hull University Teaching Hospital. Chris, would you kindly lead off our webinar?
Thank you, Lena, and thank you folks for joining us in this session today. I will spend 2 minutes highlighting Zebra, how we're contributing to this wonderful implementation at Hull. So for those of you not familiar with Zebra, we're based out of suburbs of Chicago, Illinois. We have about 10,000 people in our company. We're global. We have many patents, over 4,000, and we focus heavily on improving patient care using advanced technologies for the betterment of patient care processes. Our technology consists of 350 healthcare purpose design products, which were made specifically for the caregiver community and the patient community in healthcare. Our product families can be categorized into the areas of identity solutions, mobile device solutions, and clinical mobility solutions, and also in smart sensing and locationing and tracking. Things such as real-time locationing, environmental sensors, and other advanced real-time tracking technologies. Today, we're going to feature one part of our healthcare portfolio, which is the RFID portfolio, but we wanted to just give visibility to the totality of our healthcare portfolio. Each of these areas, we're market leaders, and we look forward to a good session today. So Eric, I will let you introduce Tagnos.
Wonderful. Well, thank you, Chris. Thank you very much. And thank you to everyone for joining us. I'll spend just a few moments introducing everybody to Tagnos and some of our solutions, particularly as they relate to what's been implemented at Hull University teaching hospitals. And then I'll hand it off to the star of our show, Sarah Atkins. So for those of you that are not familiar with Tagnos, we are a software company. We work exclusively in healthcare, and we develop workflow automation and efficiency software that's specifically designed to help healthcare staff manage and improve workflows. We enjoy a very nice partnership with Zebra. Not only are we a software partner who provides front-end software that absorbs the data from Zebra products, such as passive RFID, but also Zebra is an investor in the Tagnos business, giving us an especially integrated and tight relationship, allowing us really to work as one in all of our deployments. At Tagnos, we have many different workflow solutions families that we call workflow orchestration. Each solution is comprised of various software modules with a variety of different functionality that might range from analytics dashboards to highly configurable real-time visibility views, sort of e-whiteboards, if you will, automated staff communications, and et cetera, purpose-built to help facilitate workflows in a variety of facilities and departments. From left to right, you can see some of the types of solutions that we deploy. Asset and supply orchestration is what we'll be highlighting today, which is designed to help facilities get the most out of their assets, ranging from equipment all the way down to supplies. Our solutions also include a variety of clinical workflow use cases that help maximize the patient journey and experience through a variety of different departments. As I mentioned, today we'll be focusing mostly on asset and supply orchestration, which is really specifically designed to do three fundamental things. One is to increase staff satisfaction. This is simply through making it easier to find and use assets, which includes not only medical equipment, but also supplies. It's also designed to help reduce asset costs by streamlining the management of assets and ensuring their optimal and safe utilization. And finally, it's also designed to reduce procedure and other delays by ensuring that everything is in the right place for the right patient in the hands of the right people. We have various software modules that are available within asset and supply orchestration, some of which you'll learn a little bit about as you hear Sarah Atkins speak, ranging from asset visibility to asset management to surgical tray visibility and management to full-on end-to-end inventory management. Some of the specific functionality that we offer is listed on this slide. And of course, we do the simple things like presenting where assets and supplies are on a map or on a list view. But we're also capable of more sophisticated things that can really aid in workflow. So for example, Tagnos is able to interface with a variety of other systems your teams may be using, from a computerized maintenance management system, or CMMS, an enterprise resource planning system, or ERP, sterile management system, and more. And this allows us to cross-functionally share data that includes location and other asset information. So for example, if an asset is in recall, or if it's due for preventative maintenance, or if it's a rental that might be due for return, we can actually provide warnings and present that information to clinical staff who might be searching for that information. And this allows us to automatically coordinate efforts between biomed, med physics, clinical engineering, et cetera. Our solution can be used to track a lot of different types of assets that you can see here on the screen, including medical devices, IT equipment, surgical supplies, durable medical equipment, specimens, consumable supplies. Many in our audience may be experienced with location tracking technologies and may be used to thinking about tracking only the equipment. And we'd like to talk a little bit about why it has become possible to track basically everything in your hospital by using Zebra's continually developing and improving passive RFID technology. At Tagnos, we have the pleasure of working with a variety of different location tracking technologies from Zebra, and we generally help our customers select what the right option for them is. There's two fundamental ways we break down how location tracking can occur in a facility. On the left, you see a threshold-based system. This is where it's generally done with a passive RFID system where hardware is installed at key thresholds and tracks tags as they move underneath that threshold. These might be doorways, they might be hallways, they might be virtual entrances to zones that you'd like to create. On the right, you see what actually many of our audience might be familiar with when they think of location tracking, which is more of an active system, where a battery-powered tag goes onto a device or onto a person and continually pulses the network, and some kind of triangulation or trilateration algorithm is done to identify the location of that asset. For those familiar, this might include Wi-Fi, Bluetooth, infrared, ultra-wideband, ultrasound, or any combination thereof. Today, we're going to talk most about passive RFID, which has been implemented at Hull University teaching hospitals. And what's great about passive RFID is although it comes with a higher initial cost of infrastructure, this comes from installing hardware at every threshold that you want to see something pass underneath. It often has a lower cost of ownership when you're working with very high volume use cases. So rather than having a battery-powered tag that may cost between $50 and $100, you have a tag that often is far less than $1, and there is no battery on that. So this allows you to track thousands or even tens of thousands of particular assets. This is kind of the print it on your own, stick it and forget it use case. And this is what has been implemented at Hull University teaching hospitals, which has allowed us to accomplish a variety of different use cases that range from asset visibility to some more sophisticated asset management capabilities. And the slide that I'll conclude with and transition over to Sarah is a cartoon we like to show that kind of shows the art of the possible. One of the use cases that happen to have been implemented at Hull University teaching hospitals is actually tracking surgical trays, which allows us to make sure that the right trays are in procedure at the right time and prevent those delays. Something that's really a new use case for a lot of hospitals that maybe hasn't been explored before that's capable with Tagnos and Zebra. And with that, it's my pleasure to introduce Sarah Atkins, an RFID specialist nurse from Hull University teaching hospitals, to talk about how they've implemented Zebra passive RFID technology, how they've implemented Tagnos software, and what the results of that implementation have been. So Sarah, please take it away from here.
Thank you, Eric. Excuse me. It's great to be here today. So my name's Sarah, and I'm going to talk to you briefly about the Scan for Safety program and the RFID project. We are very excited at Hull University to work in the Scan for Safety team, and more recently the implementation of the RFID project. At Hull University, we concentrate on the 4 Ps, which is we scan the patient, we scan the product, we scan the process, and we scan the location. Next slide, please. So the Scan for Safety was introduced by the Department of Health and Social Care to encourage better patient care with supply chain efficiency and improved clinical productivity. We offer, the service that we offer offers great service inventory management, so it automates delivery it automates orders when we use a product, and the benefits of RFID are just absolutely massive. It's been a complete game changer for us to be able to track and trace not only medical assets, but again, like Eric said, surgical trays against all throughout the hospital. And we offer data reporting as part of the Scan for Safety process as well. So if any clinicians or heads of departments want to see activity in their department, we can pull off a report and send it to whoever would like it. It's also sent to board as well. Next slide, please. So for a programme that puts the patient at the heart of the journey, Hull University Teaching Hospital was not one of the 6 demo sites that implemented Scan for Safety. So we decided to do it ourselves. And sort of we changed the model a little bit, and we actually put the patient in the middle rather than sort of follow the theatre corridor or the theatre pathway, which is what the other demo sites did. We implemented based on where the patient pathway starts and patient pathway ends. So we have 23 areas which we are live in, and they range from like surgery, inpatient, outpatient, And we also sign out assets, track assets to the community, such as ventilators and T34 pumps, which we are used for patients that need palliative care. We also have more areas which we are going live with, which will follow. Next slide, please. So, like I said earlier, the approach that we took was different to the patient process that the other demo sites took. So we track sterile trays for sterile instruments and trays, which we use for surgery. We scan a patient on admission, so that's where the point of care starts. So they may arrive to the surgical admissions lounge or on a ward. So we track their progress and their pathway from there. We track them through to perfusion, anaesthetics, surgery. They may go to the intensive care unit, or they may go to a ward, or in some cases they may go to mortuary, which is where their patient journey would end. We capture a lot of data with the Scan for Safety. We captured all patient details, the location, the surgeon or specialty. We track the staff. We track the staff, the time the surgery started, any secondary procedures that were carried out on that patient. We scan packaging and scan sterile trays. Next slide, please. So these are some numbers from our hospital, what we've accrued so far. So we have over 72,000 assets on the medical equipment library. We have 16,500 sterile trays, and when we are fully operational, we can process 2,500 trays a week. Now, the RFID readers, we have 242 of those with 620 antennas which have been installed. However, this is likely to treble because we are just having built at the moment a new day surgery unit, which is going to house 12 new theatres. So we'll obviously need RFID readers and antennas put in there. We also have a new endoscopy building, which is just being built as I speak, which is going to house 4 treatment procedure rooms to carry out endoscopy surgery. We have currently installed 5 miles of cabling, which is across both sites, because our hospital is a 2-site hospital. We have 130 transport trolleys to transport the sterile trays to and from sterile services back to the hospital, and over 623,000 square feet of area covered. Next slide, please. So we have a lot of firsts at Hull with the Scan for Safety. So we were the first to scan within an ICU unit. We were the first to implement the patient pathway approach. We were the first to scan items to community patients, for example, the ventilators and palliative care pumps, which I just mentioned. And we were the first to scan to mortuary because some patients, that is where their patient journey ends. We were the first hospital to be awarded a global digital exemplar for implementing RFID, which is available on the NHS digital website, which we're also very proud of. We were also a first to be a non-demonstrator site to be included in the GS1 best practice documentation as well. Next slide, please. So the data that we capture and why. So why we feel we need to capture this data is when a clinical area needs an asset, they need it for a patient and it's usually there and then. So a lot of the time, some clinicians would go off, or staff would go off and spend quite a lot of time searching for assets. The commonly searched asset, 2 assets in this hospital are bladder scanner and ECG machines. We need to be able to find assets, and quite a lot of the time, which has opened my eyes in this project, is that assets are not where they should be. So we need to find them, and having RFID and the T52 handheld on the sled, which means we can type in the number, the asset number, and either look on the desktop or take the T52 handheld round an area and we can find it quickly. Also, the assets need to be quarantined in a timely manner. So if we get a product recall, which occasionally that we do, we would then search our database and see if that product was used on a patient. Now, during COVID, we had some ventilators that were recalled. And with the Scan for Safety system, we were able to locate those ventilators, locate the patient, have them swapped out and quarantined back in the hospital. We also need to ensure that the maintenance dates are adhered for assets which require servicing or maintaining, or need taking out the system because they're old and need replacing, which also needed to create an up-to-date equipment library with the clinical engineering team. So it was just a case of working together, why we need to find this data and why. Next slide, please. So the picture of the before is a picture that I'm sure many clinical people watching this presentation will be familiar with. Before we had an effective inventory management program, we used to store all our implants, and in an implant book, whether it be a heart valve or an orthopedic implant, breast implant, we used to store them in those books that you can see. So if a product were to be recalled, such as cath labs, which is the example that's on the slide, there were 62 products affected with 91 different serial numbers. 23 patients were identified using the Scan for Safety system, and it took 3 hours, whereas we identified all stock, quarantined all the stock, and set warning flags against the recalled asset items on the handset. This saved absolute hours because one clinical person to go through all those books would take hours and hours and hours, a week, if not longer, with one person, a week, maybe with 2 people. And that is taking staff away from the clinical areas where they're needed for patient care. Next, please. Next slide, please. So the slide that you can see now is what we have, an active recall alert. So if a product had been recalled and we were able to put that flag on it, if for some reason that product hadn't been taken out of the system and somebody were to open it and scan it to a patient, that warning would come up, which is absolutely imperative because nobody wants an ever event or a serious untoward incident, and nobody wants harm to come to a patient either. So that is why this, again, is really, really important, because people are human, mistakes do happen, but with this, it reduces mistakes to an absolute minimum. The picture on the right is a product mismatch. So for example, if a patient was having a right knee or a right hip replacement and a left implant was opened by mistake, if we scan that packet, the product mismatch would come up, so they would know not to use that implant for that patient. Next slide, please. So some cost saving examples. So not only is time saving for staff a big bonus, we've also managed to save some money as well. So the picture on the screen of the wheelchair, before we had RFID, there used to be global emails, internal emails sent out asking if staff had seen like that wheelchair, asked if they'd seen various assets that had gone missing. So now we can just look on Tagnos, we can search for that asset and we can find that asset for that member of staff, for that department, which again saves valuable time of a clinical person or a housekeeper leaving the ward, leaving the department and spending hours going looking in a hospital. That is absolutely huge. We have also labelled negative pressure wound therapy pumps. The matron of the tissue viability got in touch with us, and her concern was that a lot of her pumps are being lost, shall we say. And these pumps are around £12,000 each. And as a hospital, we hire these from a company. So since putting RFID labels on them, we have been able to track and trace every single one of those pumps that's been allocated to a patient, and we have seen their journey around the hospital. We've also labelled our specialist beds as they come off the lorry, literally. I usually get an email saying, Sarah, we've got, say, 50 new beds for maternity, and I'm usually there labelling them as they come off the lorry. Video laryngoscopy. When I was setting up the robotic suite, I ordered a video laryngoscope, which was £17,000. The base got delivered, the stand got delivered, but the video monitor never got delivered. So I spent hours and hours, not only of clinical time, but my own time staying back, going through theatres, searching the ICU departments. We've got 3 of those at Castle Hill alone. Could not find this video monitor. So I contacted the company and I said, have you got a serial number for the monitor? So they emailed me back with the serial number. I was then able to email our clinical engineering, who then found the monitor, but it was at our other hospital site being used in another ICU department. It was quickly returned to us and we was able to open the suite and it all went ahead. But it's just things like that that are so time consuming. And if we'd have had RFID at the time, that wouldn't have been lost and we would have found that straight away. We have also helped track theft of equipment from a ward that is open like literally Monday to Friday. So somebody was coming into that department and taking things that didn't belong to them. So with sort of discrete RFID label placement, we were able to track where the items were going and let's just say the theft stopped. Next slide, please. So the RFID solutions overall benefits, well, like I said earlier, RFID has just been a massive game changer for us at Hull. It improves quality of care to patients because when you need an asset, whether it be a bladder scanner, an ECG machine, a blood pressure monitor, a urinalysis machine, you can find those assets in a timely manner and send a member of staff off to go find that asset so it can be used on patient care. Reducing capital investment. If we can find equipment, we don't need to replace it. We found a lot of equipment what places didn't know they had because it was kept in drawers, cupboards, and also with the up-to-date, working with medical physics, we have an up-to-date medical library, so the information is just seamless. Reducing, eliminating unproductive clinical and medical engineering time. The guys in clinical engineering, med physics, absolutely love the handheld. For them, they can just type in the asset number, what they're looking for, look on the database, find out the last known location and take the handheld and just, they can find it within minutes. They know if it's in a locked cupboard. And if that piece of equipment's been used in a theatre, for example, then they know where it is and they can send a technician back when theatre's finished and just swap out that piece of equipment. Again, before RFID, the medical physics guys just used to have a piece of paper with the asset numbers on and they just used to wander around the hospital. And now with RFID and quick find on the handsets, all of that is, the time saving is just absolutely brilliant. Reducing, avoiding learn equipment expensive. Well, we know where stuff is, so we don't have to hire excess because we can find it. So therefore we're reducing extra learn charges. And another big one is we don't have to cancel operations if we don't have a sterile tray, because we can see in the system whether a sterile tray is in a storeroom because we have an antenna and a reader in the storeroom, and it's all in live time. So we know whether when a sterile tray has left sterile services and made its way to the hospital, and it might have been delivered to the wrong department, but we can find that on the system and rather send somebody out searching through all the theatres, we can just pinpoint it and somebody can go get it again. And that's avoiding keeping the surgeon waiting, which again reduces operating time, and it just performs more clinically efficient. Next slide, please. So this is what RFID looks like at Hull University Teaching Hospital. So the labels may be small, but the impact is huge. We know what is in a storeroom because of the readers that are in the sterile tray storeroom. This is one of my colleagues, one of my members of my team, that's Mikey. He's busy working away at his print station trolley. It's not just about labelling for us at Hull. It's about correct label placement, where the best place for a reader, the label is going to be seen by a reader, whether it be on the top or at the side. If you've got a patient going from theatre to the ICU, they usually have minimum 4 syringe drivers. And if you have the RFID label on top of that syringe driver, that's not going to be picked up by a reader because it's stacked on top of each other. So for things like syringe drivers, we know the best place to put the label is on the side to give more readability for the reader. And the picture on my right is a picture of Tiju. He's using the TZ52, which is on the sled. And this is what the team love about the mobile handheld device. It's because you can just walk around with it and it finds stuff pretty much straight away. We have a good little team with us, and without my team, I couldn't do my job without them. Another addition to our printing station trolleys is that they are battery powered. So my team can effectively go up to a bed space, whereas before they weren't, so we had to like unplug them. But since we've had the battery packs put on, it's just again been another game changer because we can just go up to the bedside, label assets as and when it needed to. Next slide, please. Thank you. Has anyone got any questions?
I'll take a moment here to pause and just say thank you for a fantastic presentation from all of you, and a special thank you to Sarah for really highlighting the overall benefits of RFID implementation and sharing those real world examples. I appreciate all of that. A reminder to the attendees to use the Q&A tab at the bottom of the screen to enter your questions. And we do have, I think, 6 questions in the queue already. So I'm going to read them out for you guys if you're not able to see them. So I will start first with, I believe this one will actually go to Eric first. Eric, can you provide additional detail on the tag you were using? Oh, I'm sorry, that would be to Sarah, but there's a part B. You mentioned it does not need power and the cost is below $1. So maybe 2-part question there. Sarah, what tags did you use? And then Eric, would you add some color around the cost?
Yeah, I'm happy to answer that. So we have 2 types of blade. We RFID label. We have what we call a blade, which was on the last picture, which was on top of a mobile ultrasound device. And then we also have a smaller label called a MIDI label. For items that have specialist power leads, we have put a MIDI label on what we call a hard plastic tag and tie it onto the power cable with a cable tie. So, and all our labels are from Zebra.
Oh, Eric, are you off mute? Just let's make sure.
Yep. My
Okay.
apologies. Yeah. Yeah, thank you. The great thing about, the Zebra passive RFID portfolio is there's a wide range of tags that are available, and these can range all the way to highly specialized, unique tags that, for example, survive autoclave, and those are, more expensive and are permanently affixed. But generally speaking, when we're telling folks to estimate their cost or their approach, we we tell them to figure about $1. Mini tags are far under $1. Some are a little bit over. Some are right about at that dollar point. But as the question noted is correct, they generally don't need any type of power source. And that really comes with two pieces of it. It's not only you're not managing a battery and the cost of that battery, but you also don't have to allocate somebody to take care of the tag itself once you stick that on.
If I could just jump in, for organizations who are considering something similar to what Sarah and her team have done, we typically start the conversations with what's your objectives, what are your requirements, what are the outcomes that you're hoping to achieve, what's the existing technology infrastructure, and then the exact technology recommendation will be fitting within your environment that's best suited for the environment versus a cookie cutter approach, one size, one model fits all. And in some organizations, you have hybrid technologies that work in tandem. So the example that Sarah and Eric shared is really effective and quite likely will work at many organizations very similar. It's not the only approach, and we have a flexible, open-minded architectural approach as we engage in discussions.
Thanks to all of you. Next question up is for Sarah. Sarah, what were some of the unforeseen obstacles at Hull?
Right, so at Hull, we have learned several lessons. One, just to communicate with absolutely everybody, clear communication and engagement with all staff throughout the implementation process. Also have contingency time in case extra installation points are required. Think very carefully about naming your zones and what you want to call them. Be very specific and think how a user would name the zone. Consider the structure of your building as particularly very high ceilings. Some antennas and readers can go on the walls because not all buildings are suitable for ceiling antennas. Naming your assets. A lot of people have different sort of names for things. Like you might know an asset as one name, but then when you talk to people in the clinical areas, they might have a completely different name for it. Also, be careful, be careful of the language that you use as well when you are talking to staff. Excuse me again. We don't use the name tag because in the UK, tagging means that somebody's just come out of prison. So we use the term label, and we don't use the term tagging because patient tracking is on the horizon. So we would not be tagging a patient. So placement of tags as well. As I said earlier, placement of your tags is absolutely key to where the readers, you want the readers to read the asset as it comes through. We know that the RFID does not read easily through your hand. So if you're holding something like a portable iPad or something, or you're carrying a laptop a certain way and you've got your hand over the RFID label, just be really mindful about where you're placing your RFID labels so you just get the best readability and range possible.
Thanks, Sarah. I'm going to add one more question for you, but I'm going to change it a little bit because it says who manages the tags at Hull, like who does what, but I'm going to change it to who manages the labels at Hull. Who does what?
So I am overall in charge of the program, and I oversee the implementation. Regarding like the labels themselves, I order those through a company called Barcode Warehouse. I have a team of 3 who I could not do without. I have a coordinator who manages the team on a day-to-day basis. She is my eyes and ears for when I'm tied up doing scan for safety work. And it's just a team effort really, and couldn't do it without any member of the team.
A couple more comments here specific to the hall, so I'll send them to Sarah. Then additional questions coming your way, Chris and Eric. How many beds in your hospital, Sarah? And how did you budget and pay for this? So that might lend itself to some input from Eric as well. So how many beds? How did you budget overall to pay for the system?
Gosh, crikey, how many beds? Well, we're across both sites. We're a 2-site hospital, and on the other site, Hull Royal, we have a women and children's maternity hospital, and we also have a separate eye hospital. Our tower block is 13 floors high. We have several thousand beds, shall we say, who have they've all got RFID labels on. They've got headers, footers, and they're on the frames as well.
And everything, yeah. I'm going to blend these two questions here because it has to do with budget and cost savings. So maybe Eric or Chris also would want to weigh in on the approach to the project. So that the budget, how do you budget for this? And have you seen significant cost savings, Sarah, as well? Whoever would like to start.
So you have to go through a process in the UK called tendering. So we looked at different possibilities, different companies, and Tagnos and Zebra were the companies that offered the best solution to what we wanted. We secured some funding to enable us to initiate the project, and subsequently have been able to secure more funding, and it has been matched by our trust as well.
And one thing I would add, and then please go ahead, Chris.
Thanks, Eric and Sarah. So broadly speaking, as we look at successful implementations all over the globe, there's 3 types of return on investment metrics within healthcare implementation. One of those is capital equipment and capital budget savings that Sarah talked about quite well. And that is often the easiest pathway to get healthcare administration to approve investments in RFID or other types of tracking technologies. But the other 2 areas that are very successful as well are the labor component. So the efficiency of the healthcare worker, which does come back to improved staff satisfaction levels. Most organizations are very interested in nurse retainment, nurse satisfaction levels, but that labor efficiency also impacts patient experience and patient satisfaction levels, which is very valuable, of course. And so that labor and experiential factor through better job enjoyment and better workflow is a second area. And the third area of ROI metrics has to do around operational capacity. When you have the efficiencies that Sarah describes, that does allow for more procedures to be done, more beds to be turned more quickly, admissions, discharge processes. So when you look at it, not from a cost savings point of view, but from a revenue enhancement or operational capacity management benefit, there often can be very significant values established in that way as well. So I thought it may be helpful to look at it globally on the broad categories of value that come from implementations of this nature.
Thank you, Chris. I wouldn't have very much to add to that at all. I think that's very well stated. The only thing I would say just in terms of the budgeting process is some of the most successful project implementations we've seen start during the budgeting process and are very much a multi-stakeholder discussion across the organization. So, asset management, folks in biomed, medphysics, et cetera, are engaged with IT, who will be responsible for a great deal of the implementation, are engaged with clinical stakeholders, et cetera. When that enterprise approach is taken early and all use cases are laid out and prioritized, that helps identify the available budget. It also helps for a successful implementation when the time comes for that.
Thank you, Eric. Sarah, a more tactical question. Do you have a label placement document that you follow, and who manages that document?
So basically, we sort of created our own label placement document because during sort of the trial period before we went sort of officially live, we wanted to test the best way to put labels on assets. So that's how we found about putting the RFID labels on the side of syringe drivers, because we realized that if they were stacked on top of each other, when we put them under a reader, we was like, well, they're not being read. Only the top one was being read. And if you've got 6 syringe drivers which are stacked on top of each other, and only the top one's being read, that's no good. So we then took sort of the labels off and put them on the sides, and then sort of wheeled them through on a drip stand under a reader, and all 6 syringe drivers were seen on Tagnos. And again, we've just found that by, so the larger objects, put your RFID label on the top. Just be mindful where, you know, if you carry something in its hand, make sure your hand's not covering the label, or put the label in a place where it can easily be seen. We did lots of walking under readers with various pieces of medical equipment to test which was the best places to put on the RFID labels on the equipment. And we've also, sorry. No, we've also worked with clinical engineering as well, because what we found was Hull Royal were applying on the mobile thermometers. The staff at Medphysics at Hull Royal Infirmary were applying them in a slightly different place to what the Medphysics guys were applying at Castle Hill. So sort of to make a more uniform approach, we got together and we sort of said, right, so we've got 3 options, this, and this, and we want to find out the best option, the best place to put the thermometer, because RFID is great for not just your big assets, but your smaller assets like your thermometers and your bladder scanners, and things that can go missing, your nerve stimulators, what you're using, anesthetics, things like that go missing. And because they're small, they get put in cupboards, they get put in drawers, they get forgotten about, and you can never find one when you want one. So we did this test, and then we found out which was the best place, where was the best place to put the RFID label, and what size label on the mobile thermometers.
Sarah, another question to you right now. Can you expand on how long it took to feel comfortable in the technology, and was there any pushback from the hospital staff or doctors?
The Tagnos system is really, really user friendly. We're just currently in the middle of writing training documents, training guides out for the handhelds, because we're just getting another delivery of some more handhelds. So for the areas that haven't got them yet, we're just updating our training guides for them. But the software is so easy to use. And sorry, Lena, what was the second question?
Did you have any pushback?
Pushback. In the beginning, some staff were like, "Oh, what are you doing? Oh, no, can you come back at a different time, or when the department's closed?" Or we did find a bit of pushback in the beginning, but now when we go out, staff are like, "Oh, I'm so glad I've seen you. I've just started delivery of this. Can you come and label them?" And our medical physics, both at Hull Royal and Castle Hill, they have their own print station. So any new medical devices that the trust gets receipt of, they have a system called Equip. So we're looking at an integration with Tagnos and Equip. So any new equipment that the hospital gets goes straight to medical physics for testing and safety testing before it gets sent out. So they're going to put the RFID labels on anything that goes through them. We are also going to give our IT department their own printing station as well, because there's a lot of IT equipment that gets broken or whatever, and is there's a high turnover of IT equipment. And if the team put an RFID label on a piece of IT equipment, it will get taken back to IT, it will get repaired, or a new one will be issued. But then that repaired one might not go back to the department that it came from, and it might go somewhere else. But that tag ID has been assigned to that computer, to that PC. So we're working with IT, and possibly, well, we are putting a printer with IT so they can print their own labels for any new IT equipment that gets delivered to them.
That's a great real world example. Great, thank you, Sarah. Next two questions up for Eric. Does Hull utilize the solution to track the TC52 devices as well with the RFID tags, or via the asset tracker plus BLE batteries? Regarding implementation, Eric or Sarah? And I can
Yes.
do this again.
Sorry, yeah, I will tell you from a Hull point of view that we have RFID labels on all of our TC52 handheld sleds, and the charging cradles as well, what they come in. We have an asset list of where our handhelds get given to, so we know what area's got what device.
Eric, has there been an observed failure rate of the RFID labels? I think this is more of a broader question as well.
Well, I think I can touch briefly on I think what I would highlight is actually what Sarah shared. It comes more from best practices as opposed to failure. I'm not quite sure where that question is going, but I think the failure rate comes more from placement, which we heard Sarah speak about. Sarah, I don't know if there's anything you'd want to comment on additional failures that you've seen with labels, but certainly from Tagnos' perspective and our broader experience, placement really is the most critical thing to consider with the labeling.
Yes, it is. And also what we learned as well is that the MIDI labels read on metal objects. So again, that's another lesson learned. But obviously now we know to just put the blade labels on anything metal.
So Sarah and Sarah and Eric, perhaps the audience question is about the accuracy rate as you do scans or data captures through RFID technology. What's your sense, Sarah, on accurate the first time and without mistakes and errors? How error-proof is the process itself?
I would say it's pretty much error-proof. Once we learn how to apply the RFID labels and where the best place was to apply them, we literally had very few failure rates, and we could see pretty much everything.
Sarah, do you currently use labels with a steam indicator integrated onto the label, or do you use separate indicators such as tape for your surgical trays?
The RFID labels, we had a space made on, so we don't have an actual RFID label in the sterile trays. The RFID label is on the fingerprint label, which is on the outside of the sterile trays and wraps. That's how we track the sterile trays.
Okay.
And Lena, just to touch more on that, that's one of those areas that we've found at Tagnos, different hospitals, different sterile processing departments have different procedures for their tray management and placement, as we've talked about with the placement of the labels being so important. One of the things that's important to do early in the process is match the current workflows. And so we've worked together with Hull to identify what was being printed at what time, and the goal is ultimately to get a tag to the outside of that container, and then also to do association with the cart, or as Hull would say, the trolleys, to ensure that we have the linkages between the trolleys, the carts, and the trays that are loaded on that. And that's an upfront workflow configuration, and more process driven than anything.
Team, there are just two more questions I'd like to try and get answered. Sarah, at Hull, is everything RFID labeled, or are there items that are not labeled, and why? I think you touched on that, but you need to elaborate again. Is
Yes,
everything RFID labeled, or are there items that are not labeled, and why?
so basically, anything that's got a clinical engineering number has an RFID label. When we go into wards and departments, or when I initially make contact with the heads of the department, I usually ask them, what are your key assets, what go walk about? And I explain the project to them and say, what are your high value, high flow assets that go missing on a regular basis? And the ward staff or the department staff will tell me, and they tell me, or they tell the team or my coordinator what they want labeling. So basically, anything an area wants an RFID label putting on, we will put a label on and create an asset for it in Tagnos.
And Sarah, do you know what analytical and reporting applications you're using to control the equipment power levels, the equipment utilization, and equipment that may not have been moved for a while? What analytical and reporting applications do you use for that?
We use Tagnos because they provide analytical reports. There's a report section in Tagnos, so if there's anything, so if a ward wants to know what equipment it owns, then we can just log into Tagnos, or even there as a band 7 or a manager will have the functionality to log into Tagnos and be able to generate a report for themselves to be able to see what assets they own. Some wards and some departments, their asset management is like top notch. They know everything. Some departments know everything what they own, but other departments don't really know 100% what they own, which is why the Tagnos reporting is very successful.
And over to Eric. I'm sorry, yes, okay. Are there any issues with sanitizing equipment with labels? And when using the labeled equipment over its life cycle, is there a need to replace labels over that life cycle?
If I understood the question, it's about with regards to whether there's any failures with sanitizing. I think this is one of those areas where Zebra has a large number of tags available. Sarah, would you mind commenting on whether or not you have any tags deployed that you're sanitizing the labels and what you've experienced with that?
So again, this is something we did testing on, and we got several labels, and we used the cleaning solution. What we clean, we have some Clinell wipes, and then we have some Tristal solution, what we use in the hospital for cleaning, and we basically rubbed the RFID labels to within an inch of the lives, really, to see if the print would come off, and if the print did come off, then how long did it take, and how vigorous rubbing did we have to do before that happened, and also the infection, from an infection control point of view, because obviously in an ICU unit or a theatre environment, the RFID labels have a potential to be contaminated with blood, bodily fluids, and you don't want that. So obviously we wanted something that was durable and met infection control measures as well.
I'm going to sneak in one last question, and if we run out of time, Eric, we may have you answer this attendee separately. So Sarah and Eric, do you analyze the RFID data correlations from the assets, the patients, and the care providers? So to phrase this question another way, who and what have been in close proximity to the infected patient at some time or in the same room?
I can comment briefly on that from a general standpoint, Tagnos has done those types of implementations and reports. So we would call those interaction reports. And we can capture what people and what things were in a given place for what period of time. And if something was in the same amount of time for a period of time, we can actually set thresholds as well. And those reports are all very configurable. one thing that's going to be new coming for as Hull University Teaching Hospitals continues to expand its implementation is actually adding the capturing of point of care utilization of assets, which is a maturing of the inventory management capabilities that are enabled now between RFID and software and how we can better use that. And that will kind of go along those lines, but I would actually point to other examples of where Tagnos has done those types of interaction reports, as we would call them.
Got it. Thank you very much. I want to thank all of the, excuse me, thank our panelists today, our experts, as well as those of you that typed in the questions. Greatly appreciate the dialogue and the information.